Hi professors, my name is Robin Hine. This is my Nursing 335 Nursing Leadership Clinical Reflection presentation. In this presentation, I will discuss my objectives for this semester, how I met those objectives using specific examples from my clinical experiences, and the nursing leadership concepts that I applied during those experiences. So objective number 1 was utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I did this in a few different ways. The first one, I used my Nursing 309 peer leadership clinical prep. This was the junior students' very first clinical prep of the semester, so they had never done it before. Many of them were very nervous, having never actually interacted with a real patient before. Unfortunately, I had never worked at Good Shepherd, which was where this experience was, but Professor Fruchtel was there, and she did help get all of the students logged into their computer system that they use that I was not particularly familiar with, but once they were logged in, I was able to help them navigate to find the information that they needed. I tried to help boost their confidence with speaking with their patients because they had never spoken to a patient before. Many of them were very nervous. Also, I did 2 of the Nursing 311 skills workshops at the end of the semester where they were practicing for their 311 practicum. So in this one, I was helping to develop their skills. Many of them were already well prepared for their practicum, but they were still practicing. So I was helping them go over their vital signs, giving them pointers on how to remember things that they needed to say or do, or help them in the order that they needed to perform their assessments for their practicum. And then also I did a blood pressure clinic at the health ministry. So in this one, I actually was able to use my knowledge of taking manual blood pressures, my experience with all of the classes that I had taken up to this point. So I was able to pass along some of the knowledge that I had, my experiences, discussing hypertension, heart disease, and also I was asked to do a little bit of research on domestic violence as their theme of discussion for the day. So if anybody had any questions or they wanted to talk about it, I would know what to say. And in doing that, I actually learned some things I didn't know, such as the hand signal for somebody who needs help, who can't actually verbalize to tell people that they're in a bad situation and they need help. So that was an interesting thing that I learned that day. Objective number 2 was to apply basic principles of management to meet the challenges of an ever-changing healthcare environment. This one I accomplished during my interprofessional day at Good Shepherd. I was working with a nurse named Monica. This day actually ended up being more like a nurse supervisor role than an interprofessional type day, but it was still very useful, very informative. I got to see her handle a lot of staffing challenges, new patient intakes, staff complaints. She was also working as a bedside nurse and was offering to help other nurses on the floor if they needed it, which some of them did. She actually did get in there and help. There was also an issue with a patient that she needed to handle directly. The patient was having some mental distress. He had been there for a while. And he had a brain injury, and he kept taking off his helmet and then sliding himself to the floor, and they ended up having to restrain him in order to keep from hurting himself. So she had to kind of deal with some of those issues. Aside from that, she also seemed to be very comfortable with the staff. Staff seemed she seemed very well respected, very well liked. Staff seemed very comfortable coming and confiding to her about their issues with other staff members, and she was handling all of that still at the same time with dealing with a shortage that day and how to get staffing coverage for all 3 floors that she had to manage that day. So objective number 3 was demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. This I accomplished during my 3 Camelot events. Admittedly, the first one took me a little while to warm up. Since I was kind of there by myself, I didn't know anybody, and the kids all seemed to be a very close group. They all knew each other. The volunteers all knew each other, and they all knew the kids. They all seemed to have a very close relationship. So it took me a little while to warm up for that one, but then, by the second 2, I was doing much better. Like, I remembered the kids' names. I was much more confident with myself and getting in there and participating with them and helping them participate in the events that they had going on. And by the third event was actually an event where they were welcoming new families in. And I seemed to kind of gravitate to this one family, and I was helping them, describe the culture of Camelot and what they do and what they stand for, and how they can meet the needs of, all the children there, and they're accommodating, and they seemed to be very, very comfortable with me, which made me feel good. And all the while, speaking professionally. And then also by communicating with nursing leaders before and after each clinical experience, setting up mutually agreeable times to come. And then afterwards, sending thank you notes, showing my gratitude and appreciation for their time, their experience, and thanking them for allowing me to spend the day with them and watch what they do. Let's see, number 4 objective was to critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. This one I accomplished with my scholarly research paper on the clinical dilemma of mandatory vaccinations for healthcare workers, and also in our ethical group project on David Vedder, The Boy in the Bubble. But particularly speaking about that scholarly paper, it was a very interesting look at how both sides of the ethical dilemma were affecting nurses in particular, because when this mandate came down, of course it's part of the ANA Code of Ethics, that the care of the patient always comes first, protecting patients, their families, the public. So of course, it would seem that instituting a vaccine mandate would be the natural thing to do in order to protect the public as quickly as possible. But a lot of nurses were not happy about that. And then I could also see their point, taking away their autonomy, their right to choose whether or not they wanted the vaccine, and how enforcing this may cause even more widespread nursing shortages, because either people were going to refuse to be vaccinated and be fired, or many would just quit out of principle rather than be forced to get the vaccine. And then this causing more widespread nursing shortages would really have an impact on safe and effective patient care. Objective number 5, function as a competent patient advocate, nurse advocate, and change agent. This I think I accomplished in my 321 peer leadership day. I spent the day on the 5K unit in the geriatric clinical. So this I was, I think, advocating for our other junior nursing students if they needed help. If they had any interactions with patients that they were struggling with, or even having trouble finding things in the charts or knowing how to document, that was helpful for them. And also by helping the students, it was also advocating for the patients, making sure that they were getting their safe and effective care. And then objective number 6, formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. This one was actually very interesting. Of all places, happened on my night and at the AICU, or the quote-unquote Doc in a Box, as you know, they're describing to me what they're doing, and I'm watching these patients in their units, in their trauma units, and I ended up having a discussion with the nurse leader there, and we talked about how so many nursing students now aren't satisfied with just becoming a nurse, how so many want to go on to be, a CRNA, or a nurse practitioner, or a physician assistant, or all these other things, and nobody wants to just be a nurse. And I actually found that that conversation really interesting, because when I first came back to nursing school, my initial plan was to go on for my CRNP, and for other reasons that I won't go into now, I'm kind of rethinking that. But it was an interesting conversation because it was a take that I hadn't thought of before. Number 7, recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. So this one we accomplished when we went to Harrisburg, to the Capitol. We got to see some very interesting things. We sat in on the budget hearing where they discussed the rising prices of prescription medications and how to sort of combat that. And we got to hear a representative from AARP talking about how she's advocating for those patients to try to be able to afford their medications. And we got to hear from, some other state representatives who are already working on that type of thing. We got to do some role playing with the representative from the PSNA. And then one other thing we were asked to do was to research a bill to discuss with our state representative. Now, unfortunately, the day kind of got away from us and we didn't have time to go speak to our representatives. But the bill that I did research was in regards to high school nurses having Narcan on hand for emergencies for students. And then my state representative is Ryan McKenzie, and I was actually really looking forward to discussing that with him, but I never got that chance. And then number 8 was to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So this one just occurred recently on my clinical experience with my nursing supervisor. Doing rounds. She came to a unit with a 25-year-old sickle cell patient who was almost 26 weeks pregnant, who had been discharged but was refusing to leave because she wanted one more dose of Dilaudid before she would leave. She was stating that she was in too much pain to leave without it, even though the doctors had given her prescriptions for home pain medications, and all she had to do was go down to the pharmacy to pick them up. She was threatening to just go to the ER to get medication if they wouldn't give it to her. But she was refusing to leave. So that was a thing that my nursing supervisor that I was watching had to deal with. And then going back and forth between the nurse on the unit and then the physician and speaking to the patient herself. And it ultimately came to the point where the doctor was still refusing to prescribe anything for her since they had already given her medications, and the nursing supervisor was saying how they would need to have security escort this patient out if she was refusing to leave, and how that would look for the hospital and the physician just kind of didn't care, and they said, no, we already discharged her hours ago, the paperwork is done. So that became not only an ethical, but also, a legal liability issue that this nursing supervisor had to deal with. So that was pretty interesting. So those were my clinical objectives. I used the Marquise and Hudson Houston, textbook, and my ANA Code of Ethics, and my own research paper and our ethical group topic for our resources. Thank you for your time.